Examining the cervical spine. Begin inspection immediately upon meeting the patient. Does the patient's head move naturally with his body movements? The anterior and posterior neck should then be inspected for any abnormalities such as asymmetry, blisters, scars, and discoloration. Find the following landmarks. On palpation of the anterior neck, the hyoid bone is at level C3. To find it, have your patient move his tongue far back in his mouth. The hyoid bone becomes prominent. The thyroid cartilage is at level C4, C5. It's also known as the Adam's apple. The cricoid ring is at level C6. Palpate the sternocleidomastoid muscles for tenderness, masses, muscle spasm, or tissue texture changes. On posterior palpation, find the occiput, the mastoid processes just behind the ears, and the spinous processes of the cervical vertebrae. Palpate the trapezius muscles for tenderness, masses, muscle spasm, or tissue texture changes. Next, we perform range of motion. Determine both active and passive range of motion. Active range of motion is when the patient performs the movements without your assistance. Flexion, extension, side bending, rotation. Passive range of motion is moving the patient without their assistance. Flexion, extension, side bending, rotation. Last is muscle strength. Remember to grade the strength correctly on a scale of 0 to 5 out of 5. For sternocleidomastoid strength, have the patient rotate his head against resistance. For trapezius, have the patient shrug his shoulders against resistance. For neck flexors, have the patient try to bring his chin to his chest with your hand on his forehead. For extensors, have the patient try to turn his head to the ceiling with your hand on the back of his head. Examining the thoracic and lumbar spine. Expose as much of the patient's trunk as possible for inspection. Observe your patient's posture while walking, standing, and sitting. Are the muscles of the back symmetrical? Is there obvious hypertrophy or atrophy? Do you see lordosis or kyphosis? Find the following landmarks through palpation and make note of any abnormality. Spinous processes. Sacral base. The paraspinal muscles, and the supraspinatus ligament, which may be palpated over the lumbar vertebrae. Perform range of motion, either active, passive, or both. We'll perform active range of motion in this example. Flexion, extension, lateral bending, rotation, and lastly, have the patient stand and bend forward from the hips, inspecting for scoliosis.